And this is a patient with black gums. So we did a laser depigmentation and also a procedure called gingivoplasty, where the gums length is reduced, so the teeth exposure is improved. So it gives a visible look that what otherwise a surgical work can cause. This is another girl, laser depigmentation with only local anesthetic. And this girl had a injury from a road traffic accident, lost one tooth. So particular to replace only with implants. So we did an implant and replaced with a tooth. No cutting of the neighboring teeth. So this is a famous Malayalam artist where she had crooked teeth like this, and we did a veneering. Just a 3-hour procedure. Her smile was changed like this. We also suggest sometimes if the malocclusion is very severe, we also suggest surgeries. This person had a long lower jaw. You can see lower jaw is very long. So this was reduced by internal surgery. This girl had a upper jaw height was very long and a lot of teeth were seen. So this is reduced. This is 1 month before her surgery, before her marriage. So she gave me her marriage photograph. So happy to do this. This is a side view of her face. And this guy, the maxilla, upper jaw was long and protrusive. So surgery was only option. So this is another case where she had a multicolored teeth. She was unhappy about it. You look at her after the procedure, she's so happy. And this is the veneering and crowns combined. So beauty is done, sculpted by Karthik, and we help him a little bit in make over the smile. Thank you very much for the opportunity, Karthik.
Thank you, Dr. Udairaj. Catering to the demands of patients, medical science, especially dentistry, has undergone breakthrough technological changes in the past few years. Lasers are the future of dentistry and have advantages as compared to traditional ways in a great manifold. It has boosted a trauma-free treatment, yet increasing the confidence of the dentist as well as the patient. Today we have with us an acclaimed smile designer, a name many Indians recognize. Qualified from Germany and Austria, Dr. Deena Dayalan promises his treatment involves no injection, no bleeding, and best of all, no pain. His involvement on the Chennai plastic surgery panel makes it the one-stop shop for all areas of modern beauty enhancement methods. Ladies and gentlemen, please put your hands together for Dr. Deena Dayalan.
I hope all the slides have been fully done with Dr. Udairaj, so I have been left out with a small amount of things. So, who am I? She has introduced me. I'm Dr. Deena Dayalan. What am I going to do? I can promise you a few of the cosmetic surgery which you all are very much scared of. Every time you come to a dentist, you all are scared of one single thing. The big injection with the mouth mask will come near you. You all are scared as though we are some kind of a chain coming and breaking you. So that breakthrough has come out just by using laser. No pain, no injection, and less bleeding. This is a breakthrough in our dentistry field. So these are the main 3 things you all are very much scared of. Sorry. Can I? Yeah. These are the main thing which you all are scared of. Since Dr. Udairaj has fully told you about a lot of pictures and other things, I'm not going to bore you guys with the same pictures again and again. So, laser, what all things do we do? It's going to be a gingival depigmentation, a bleach, root canal, and tooth filling. These are the major problems you all will be having more amount of pain. We bring art of excellence, the edge cutting technology called as the erbium YAR lasers, which is going to mock all your pain, and you all are going to enjoy the dental treatment. Could you just put your arrow on the laser and click it? Sorry. Okay. So what we do with the help of laser, this
Now
is just a
we use
light.
the laser initially
This is just a light which is going to,
to kill
take
bacteria
most of the
that
granulation
cause
tissue
toxic
which is there for the periodontal treatment. We use it like this because most of the time the calculus which is there down beneath your tooth cannot be cleaned properly. So the laser helps in just at least viewing what exactly the calculus have been attached in which depth. So this is going to help you all, to see the calculus and to bring your dental health in a better way. The same thing has been used even for the dental pigmentation. All the pigment which is there in your gums, which will be removed within a fraction of minutes, I would say. Say maximum 5 to 10 minutes. You come back here, you're going to remove everything, and we're going to send you out with a coral pink. Believe me, within a week, you all are going to become a model. And I'm guaranteeing you that you're going to have a fantastic smile. So boys, you got to be careful because the girls are going to get more smile. It's very difficult for us. I have one in my house.
Between the gum and
Right?
the tooth
Could you just
to kill bacteria inside of the
go back to
pocket,
the
which remember is the
slide.
source of the problem.
Yeah. I'm sorry, again I have to intervene you guys. Right. Next one which we all would go in for is the implant. Again, the art of excellence. Most of the time, you get a good wife, you get small hittings and 1 or 2 fractures when happen. So that was the same case here. Please don't tell this to Anita, that is my wife. So that is a known friend of her who had a fracture, and we are doing a small work that is a crown for the, for this tooth, and an implant has been placed. Believe me, how much time do you think we might have done this treatment? A week, 2? These are immediate implants. Within a day, we have just fixed it. A crown has been done. Within 2 days, a ceramic crown, the art of excellence, the so-called as lava 3M products has been released. And this is another one more abutment we call it. These are high strength one which is going to bring you more amount of aesthetics. Every time when you're going to take some kind of a photograph or something like that, if it's going to be white, it's going to absorb a lot of, it's going to reflect a lot of light. Black is going to absorb more amount of light. These type of abutments, whichever is there, it's going to give more amount of reflection, bringing you these type of smile. Just imagine, these are microscopical pictures. All the photographers, whoever knows about the photography can accept the pixels and voxels, see the quality of the gingiva what we have produced. This is what the challenge is all about. It can be, as Indira said, it can be a vegetable vendor or a milkman or anyone. We are working for these type of micro architects to be developed for each and every one of it. It can be any Tom, Dick and Harry, whoever you name it. But we want to bring the smile to each and every one of you. That's the reason Karthik has handpicked each and every one of us to show and to do and to make you all smile a lot. That is what the main purpose, what we are for. So this is Karthik's patient who came to us with a great smile. She is from Sri Lanka, and this is what she is. See the glow, what it is. This is responsible, Janani and Bhairavi are the 2 girls who are responsible for these type of glows. I always wonder, I used to say them, why can't you do this for me also? But you see, I'm naturally like that, so I don't need that, and used to say. So I got to catch them both and I have to get the same glow like that, right? So another one more patient, which Dr. Udayaraj sir might have been recognized. This is a pre-operative or pre-orthodontic, we can call it. You name any type of cases, you can see this. A big open bite, we can call it. A tongue has been totally protruding out. Fully a protruded maxilla. His name is Justin, who has quit his college. Severely he had depression, he was not going to college. This is after the orthodontics. See, most of the open bite has been corrected. Only thing is, he have a very huge maxilla which we have to correct it up. Now Justin has changed himself to Romeo and he has got 2 girlfriends. Believe me, I'm not joking. He has 2 girlfriends. I've seen that fellow. Yes. So, no, I'm serious. Don't laugh. He has 2 girlfriends. Can you see long hair? I don't know. Yes, he's not. Yeah, he's in trouble, sir. I have to accept with the boss. The rule number 1: always say yes, whatever the boss is saying. Rule number 2: in case the boss is wrong, refer to rule number 1. So Udayaraj sir says yes, yes it is. Right? So Justin, this is what the improvement. I'm not going to put you more slides just to show you how we can make the difference. Not just for the dental alone. He had a huge amount of depression, which the psychiatrist has a huge amount of role. The orthodontist comes in. After that, the maxillofacial surgeon comes in. After all these things, he has to go for a correction of his nose too. That will be given to Karthik. You know, every time, I don't know, you may get one more girlfriend also after getting the nose done. Sorry, I didn't get you, ma'am. You want his address? I'm sorry, I cannot give you that. That's as proper. You could able to appreciate from this to come to this, it takes about a year, but still, the aesthetic is the only concerned thing which we all are much, much more worried about. So this is what we bring to the ideality. And coming to the dental thing, which Dr. Udaya sir has totally stolen the show. And orthodontic work, nothing can be compared. They make the entire thing to come to the very much near normal one, and we make it normal. It's a small job, you can say, but still after the theatre, you enter inside the theatre, the big gun is there nearby you, then it's not a problem. Dr. TNS, the anesthetist, every time if he is there, you can forget whatever problem you have. In the film, old films you used to say, the same thing you guys can get. I am one type of a victim for TNS. It was fantastic. None of the alcohol beverages which is kept there cannot even compare to him. You sleep, you forget your wife, your children, everything. The moment after three hours again, you'll bring back within any problem, it will be back. I hope that permanent, solution comes, it will be good. Right. Thank you, ladies and gentlemen, for giving me this great opportunity to stand and talk in front of you all. So, happy birthday, Karthik. And, I'm sorry. And, see, just a petal alone cannot make the entire flower. So, we all joined petals, we have made a small flower, which will glow nicely, and we'll make sure that the essence will flow into each and every one of your ear, nose, eyes, as well as your entire body will be filled up with beauty. Beauty and beauty. Thank you, ladies and gentlemen, again for giving me this opportunity. Any doubts, you can ask me except the address of that boy.
Thank you, Doctor. You definitely seem to be motivating all the single people in this room today. Cosmetic surgery enhances physical as well as mental health. Easing patients' minds into accepting their new avatars or getting them comfortable with going into self-improvement is very important. I would like to introduce to you Dr. Mini Rao, a psychologist with a successful private practice who also works with Chennai plastic surgery. She counsels the patients on their need, their motivation behind the surgery, and their expectations, and also helps them cope with the changes made to their face or body after surgery. She writes for various magazines and newspapers and regularly conducts personality development, motivation and stress management workshops for young men and women. She also does content development for behavior disorders among school children. She was recently approached by a filmmaker to discuss a script regarding schizophrenia, and her PhD thesis has been published by an international journal. Ladies and gentlemen, please welcome on stage Dr. Mini Rao.
A very warm evening to all of you. I am not too well, so just forgive me for my hoarse throat. I just want to give you a brief introduction about cosmetics, the connection between cosmetic surgery and mental health. So we'll start off with, let's start the next slide. So, see, these are examples of cosmetic surgery. You can see they're all very famous personalities. There's actress Shilpa Shetty. There's the actress Angelina Jolie. They all look fabulous after surgery. Okay, so let me take you to reasons why people have cosmetic surgery. One reason would be because a lot of people think they'll be more loved and accepted by friends, by family, by society in general if they are more good looking. That's such a total misconception, but I'm not getting into that now. But okay, the next reason is, no, just go back to that. Yeah. The second reason people do cosmetic surgery is because they want to defy the normal aging process. right? See, when we get older, we have all these a sagging abdomen, drooping eyelids, or sagging cheeks. So we want to actually look young, so we go for cosmetic surgery.